So then the next question leads into kind of the so what? So why do we do this? Like, does it impact my treatment decisions? Does it impact my prognosis? What are we looking
Mhm.
for, and what does the how does it impact our
Yeah, so it's a big so what. So the first thing that is most critical, I think, and time sensitive is that it does impact treatment decisions when you're diagnosed, right? And so the way that can happen is, first of all, it can impact your surgical decision. Maybe you were diagnosed with a breast cancer in one breast, and you're thinking, we get this a lot. Should I have a bilateral mastectomy? Should I have a double mastectomy? If you were found to have a germline mutation, which would suggest that you have high risk of developing another breast cancer, then there's more options for you to consider surgically. In terms of radiation and then medical treatments, there are also considerations to know whether or not you have these germline mutations when we're thinking about even early stage cancers, which medications, which treatments you're eligible for if a germline mutation is found. Um, those are, I think, the most kind of timely when you are first diagnosed and you're trying to think about what the entire course of action is going to be with the surgery, if radiation is going to be involved, and then if there's any need for medical treatment. Um, Beyond that, after the kind of treatment decision is made, of course, it's important in terms of knowing if there's something in your family that other people could have inherited. So again, this is why I said the most important person to test is the one that has cancer, because that's the highest chance of actually finding um, something that has some significance. And, if it is found that you have something that could be passed through your family, then it will impact the other people in your family in that their screening recommendations could change in terms of the age that screening would start for those people, and also certain prevention methods that could be available to them if they also have the mutation that you do. And so it doesn't mean that everyone in your family has it, but it does mean having those conversations with the family, sharing that information so that they could then get tested and see if they have that same mutation, and then what that means in terms of their earlier screening or prevention methods.
yes.